One of the great things about being a PA, and to some extent an NP as well, is the flexibility we have within our profession to work within the different medical specialties. Unlike physicians, we aren't tied to just one particular specialty. But some of you may wonder about the best way to get into working in one of those specialties after you graduate, or if you've been working in one field of medicine, how you actually go about transitioning to another specialty. Say you've been working in ENT, but then maybe you want to try emergency medicine. You may have doubts and be overwhelmed by the amount of medicine that you may have forgotten because it's not part of your current practice. So the goal of the video today is to show you some ideas of how you might find out if the specialty you're thinking about is really something that's going to suit you, how you might go about preparing so that you can feel competent working in that specialty, and then how you can become a good candidate to get hired in the specialty. So stay tuned. A lot of good stuff coming up.
Hello. Welcome.
So before we dive into the content for today, I just want to introduce myself. My name is Michelle Cameron. I'm a PA, and this is The Medicine Couch. It's a new YouTube channel that I've started to help medical professionals improve their practice and find their fit in medicine. If you're liking this content, I would ask you to please hit the like button below. Let me know that this is the kind of videos that you would like. Leave me a comment in the comment section. And if you want to, please subscribe to the channel and hit the notification bell so you know when I release videos. So with that being said, let's dive into the video for today. So if there's a specialty that you're interested in and you think that might be where you want your career to go, the first thing that you need to do is obviously learn as much as you can about that specialty. Visit the websites for the national organizations in that specialty. Every specialty has one. Sometimes there's specific PA or NP groups. Sometimes they're national physician groups. But it doesn't matter what your license is. You can go to any of these websites and they all have tons of free information. You want to look for the top news that's happening in that profession. You want to look for any kind of forums or discussion sites that you can find to see what people who work in that profession are talking about, what their pain points are, what they like about the specialty, get an idea of, how many patients they see a day, what their schedules are like, those kind of things. Most of the time, they'll have a lot of free information about the conditions that are seen in that specialty most often. They'll have guidelines, some CME activities, all kinds of things to help you really understand what is seen in that specialty and to help you learn and get prepared to work in that specialty. The next thing I would do is go to job boards like Indeed or Glassdoor, something like that. It doesn't matter. You don't have to search by region. You can just search all across the country. What you want to do is read these job postings to give you a better idea of what those jobs entail. Sometimes they'll list like the duties that you have to do. They'll talk about if there's call involved or not. They'll sometimes list what the schedule is, the working hours. Some specialties like dermatology is famous for having 4-day work weeks. Emergency medicine, usually work like 3 12-hour shifts a week. But then there's other specialties that you'll see all the job postings are 5 days a week and they include call on the weekends. So that is something important that can help you determine if that job may be right for you. And sometimes they even list the salary that they're offering so you can get an idea of what that specialty pays. So another thing I want you to pay attention on these job postings is to look and see if there's any certifications or any specific skills that you see are constantly being mentioned that you should have. While you're thinking about these specialties, or if you decide on a specialty, you'll have a plan of action of what things that you'll need to acquire to make yourself a good candidate. Once you've identified the specialty that really interests you and you know that you want to work in that specialty, either transitioning as a current practicing provider or as a student getting ready to graduate, then you can start taking some action. There are going to be things that you see as a provider in the specialty you're currently working in that pertain to the specialty that you want to transition into. For instance, if you work in urgent care but want to transition to ear, nose, and throat, think about all the different conditions you see that have to do with ENT. Start making a list of those. Document how many times you see that particular condition. Make a disease sheet listing the common presenting symptoms, any tests that are associated with diagnosing that condition, labs that need to be drawn, what the standard treatment is, what the guidelines say. Start gathering all that information. You can make a little notebook or, keep it online. So by doing that, not only will you learn more about the different conditions and help prepare you to work in that specialty, but it will also reinforce to you how much you already know about that specialty, and you'll be able to relay that to a potential employer, and you can even show them a log that you've been keeping. As a student, you can do this as well. If you're volunteering at a student clinic or if you've started your rotations, you can watch for when these conditions come up and you can do the same exact thing. And don't forget, in addition to the conditions that you see, you can also document medications that you're familiar with. There are a lot of medications that are used for different things amongst the different specialties, but it's the same medication. So when you are looking up a medication in Hippocrates for your particular specialty, but then you realize it has application in other specialties, make note of that, write that down, get familiar with the different medications you can use. So when you work in that specialty, you will already have a good idea of some of the medications that are available. The other thing that you might think about, especially if you work like in family practice or urgent care, is that maybe you can try to become the person in the office that handles those particular conditions the most. Sometimes you can carve out a little niche in your practice where you're the person that sees all of the derm cases or most of the ortho cases. Whatever you're interested in, see if you can funnel those cases to you. It's not always possible, but if you have that option in your clinic, then it's something you might consider doing. Not only will that help you gain even further experience, but it'll also help you know whether that's something that you want to work with all of the time. You may do that and find out that you don't like those conditions as much as you thought you might. Next, I would suggest shadowing. Yes, I know you may already be an established provider and have been working for years, but just like anybody that's starting, if you want to work in a new specialty, the best way to really see what that's like is to shadow. Take vacation at your current specialty and go shadow. Really pay attention to not just the conditions they see, but all the other things that are expected in that specialty. You can really figure out what the pain points are and what things you might like and not like about the specialty. So another tip that I have is to utilize drug reps, especially if you can get in contact and meet drug reps that rep specifically for drugs used in a particular specialty. Those reps are going to know a lot about the different conditions seen in that specialty. They're going to be able to teach you about the different drugs and medications used. They may also be able to get you into a dinner they're hosting about a condition in that specialty. And there's going to be lots of other people who work in that specialty there, so you may have the opportunity to network and find a position. But beyond that, the drug reps themselves are in and out of those specialty offices all over the city that you live in. They know what offices are currently looking to fill a spot, but they also usually know what offices are going to have positions come open before they're even advertised to the general public. So I would encourage you to spend some time with the drug reps if you're able to and get their business card. If you're not ready then to look for a job, they are great people to call later when you're searching. So once you've figured out that what specialty you definitely want to work in, you've spent time learning about the conditions in that specialty, and you've made your little cheat sheet notebook, then start looking. Of course, you can start with the traditional job boards, but also remember to check with the health systems in your area. A lot of times on their website, they will list jobs that they don't post anywhere else. You can also reach out to recruiters from placement agencies. Sometimes they'll know about jobs that aren't listed elsewhere. Don't forget to check the job boards on the national organization websites. And if your employer knows that you are wanting to transition and leave, or if your job search is not something you're trying to keep private, then you can also post in forums and on social media sites saying that you'd like to transition to that specialty, and does anyone know a place that's hiring? There's a lot of times I see in message boards where people say that their office is thinking about adding somebody, but they haven't advertised it yet. So it's a good way to kind of get in before a lot of applicants start applying. Of course, your resume, you want to beef it up as much as you can. Looking at that log of the conditions that you've seen that pertain to that specialty should give you confidence that you do have some experience in that specialty, and you can write your resume and your cover letter in such a way as to highlight that that is an emphasis for you and what you've been doing to prepare for that specialty. Of course, if you've had a rotation in that specialty, that is very helpful as well, and make sure that that is listed on your resume for sure. You might also consider joining the national organizations that we talked about. You can put that on your resume, and that can be another signal that you are serious about pursuing this specialty. So if you're having difficulty actually getting hired into the specialty that you really want, or if you're a student that's just graduating, you might consider doing an NP or PA residency or fellowship in that particular specialty. The opportunities for those have really grown a lot over the past few years, and many of the specialties offer them. In fact, some specialties like emergency medicine do actually have quite a few of those programs available, which increases, of course, the number of spots and the chances of you actually getting into the residency or fellowship. Those programs typically last for about a year. You do make a salary, it's reduced, but you are getting valuable experience. And most people that come out of those programs don't really have a difficult time finding a job in that specialty. So I mentioned that both PAs and NPs have the flexibility to work in different specialties. And while that's true, NPs do have another thing that they have to consider, and that's their certification. Unlike PAs who, once they're certified, can work in anything, NPs do have to have specific certifications to work in different specialties. So for instance, if you want to work as a hospitalist, the hospital may require that you have an acute care license, not just having an FNP license. If you want to work in pediatrics, but you have a geriatrics license, you'll obviously have to go back to school and get that add-on certification for pediatrics. So that's something you want to pay attention to, and if you're unsure about what license you would need, what certification you would need to work in a particular specialty, then I would suggest talking to the Board of Nursing in your state to see what their recommendations are. Hope that's given you some ideas on how you might become a good candidate and transition into a specialty. If it's been helpful for you, please hit the like button below. Leave me your thoughts in the comments. And if you know of something that can help other providers that I didn't mention, please also put that down in the comments and share with others. Until next time, stay sane out there. Bye.